Hi, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for parents and caregivers of 9-month-olds. Tip number 1 is consider yourself the primary protector of your infant's curiosity. During the first year of life, the primary role of parents is to protect your children while still allowing them to explore the world. At 9 months old, they're going to have an increased ability to move around the world. And so it's your responsibility to protect them from harm while at the same time letting them explore and be curious. It's preferable actually than trying to teach the baby how to be safe. Just make their environment safe. Tip number 2, home safety. So going along with this idea of making their environment safe instead of trying to teach them how to be safe, don't leave heavy objects or containers of hot liquids on tables with tablecloths, as they might pull down the tablecloth and that can lead to some serious harm. If there are hot areas in your house, such as space heaters, wood stoves, or kerosene heaters, make sure that there are barriers between your infant and these areas. Make sure you keep electrical cords out of reach, as children can chew through these electrical cords and get mouth burns. Make sure that on all windows that are above the ground floor there are window guards. For all stairs, there should be gates at the top and the bottom of the stairs. Whenever your child is around water, they should be constantly under direct supervision. And all household chemicals should be locked and out of reach of your child. So tip number 1 was considering yourself the primary protector of your infant's curiosity. Tip number 2 are some tips for home safety. Tip number 3 is discipline. Discipline depends on consistency among caregivers. So if your mom and you both take care of your baby, it's important that you both have the same rules for your baby. And it's important to establish appropriate behavior and to reinforce appropriate behavior. Because babies have a short attention span, distraction and replacing a forbidden object with one that's permissible is an excellent strategy for managing your baby's behavior in a positive way. Yelling and spanking are not effective in changing your baby's behavior. So if your baby's doing something you don't want them to do, instead of saying don't do it or spanking them, give them something that it's okay to do. Tip number 4, no screen time. So before 2 years of age, no babies should be watching television, should be watching DVDs, playing video games, using computer products. Instead, actively engage them with talking to them, playing with them, going for a walk, reading a book. Tip number 5, feeding. Here are some important tips about feeding your baby. You decide what your baby eats, and your baby can decide how much your baby can eat. So your baby should not be choosing what he or she eats. That's up to you, and your job is to have a nutritious and diet with a lot of variety. Your baby can start to be on the same eating schedule as your family, with breakfast, lunch, and dinner. You should also give your baby 3 snacks throughout the day. 1 between breakfast and lunch, 1 between lunch and dinner, and 1 at bedtime. Be patient with your baby as your baby tries new foods, and don't give up if your baby doesn't like a food at first. It can take 10 to 15 tries with a food for your baby to accept it, and it's important now to have your baby develop a well-rounded diet and not just eat one thing. Remove distractions when your child is eating so that your child is more likely to stay focused on eating. Juice, 100% fruit juice is okay, but should be limited to only 4 ounces a day. And your baby should not be given any kind of sweetened drinks or soda. Also, until 1 year of age, you should avoid any nuts or shellfish or seafood. These can cause food allergies, so they're better to start at age 1. Tip number 6, sleeping. It's not unusual for your baby to, if he was previously sleeping throughout the night, to start waking in the middle of the night at 9 months of age. When he wakens and realizes he's in a dark room and his parents aren't there, he may become distressed and cry. The best thing for you to do is to go in there, comfort him, make sure everything's all right, and let him go back to sleep. This routine can help him put himself back to sleep the next time he cries. Tip number 7 is car safety. At 9 months of age, your baby should be sitting in the back seat in a car seat that is facing to the rear. Your baby should stay in a car seat until 1 year of age and until he weighs at least 20 pounds. It's actually preferable to wait even longer to switch to a forward-facing car seat. You can use the baby seat until the height and weight of your baby reaches what's allowed by the manufacturer of the car seat. Tip number 8 is give yourself time for yourself. This is an important aspect of caring for your baby in order to remain sane yourself and to be able to be 100% present for your baby. Tip number 9 is to make sure you see a doctor. During the 9-month-old check, your doctor will do a structured developmental screen to make sure your baby's on track with all of her milestones. Also, here's an opportunity to catch up with any vaccines. There are no vaccines that are scheduled at 9 months, but if you missed any 6-month-old vaccines, now's the time to make them up. You may also be offered the influenza or flu vaccine, which is a 2-part series when it's begun in the first year of life. And if it was given at 6 months, the part 2 of the vaccine would be given at 9. Tip number 10 is to believe in yourself. I've described 9 tips for caring for your baby. Considering yourself the primary protector of your infant's curiosity, tips about home safety, about discipline, about avoiding any screen time, tips about healthy eating, tips about sleeping, about car safety, and about having time for yourself, and lastly about seeing your physician. All these tips have been well researched and there's a good benefit to come out of them. I hope these tips have been helpful and thank you very much for listening. Have a great day.